Have you ever heard of post-birth control syndrome? Bet you probably haven't, and your doctor probably hasn't either. Hi, I'm Dr. Jolene Brighten, and in this video I want to chat with you about something that's pretty common but not very commonly talked about, and that is post-birth control syndrome. Now, you probably never heard of this because it's a syndrome. It's not really a disease. And what that means is that it's a constellation of symptoms. And you may have some of them, you may have all of them, or you may only have like a handful. So post-birth control syndrome, just like the name sounds, it comes on after discontinuing the pill. So you break up with the pill, no matter how long it was, and then what starts to sneak in is some unwanted hormonal symptoms. For the most part, that's usually what women see. But other women can also develop hormonal irregularities that can result in them not having their period or having very irregular periods. I've had this happen in patients whose periods were like clockwork until they took the pill, and then everything was disrupted and their period never really came back to be the same. So how does that happen? Well, the pill does this very wonderful thing in shutting down ovulation so that you don't become pregnant. This is good, right? If you're taking the pill not to become pregnant, the fact that it does its job is very good. You take a big dose of estrogen, and in what's called a negative feedback, it shuts down your brain. So it shuts down two hormones, FSH and LH, follicle stimulating hormone that gets the egg ready, and luteinizing hormone that helps you ovulate. But with all those hormones floating around, it shuts it down and no ovulation happens, which is exactly what you want if you're on the pill. But when you're off the pill, you want your brain to be talking to your ovaries again the same way, which is sometimes a little harder for some women to reestablish that connection after they've been on the pill, and that can be months or that can be years. Now, usually we see post-birth control symptoms. They're usually like a month or two after you stop the pill, we'll start to see symptoms to arise. And now that's only for women who are really paying attention and doctors who are really paying attention. Otherwise, it seems to be that 4 to 6 months seems to be the sweet spot for when most women are presenting with symptoms to their doctor after discontinuing the pill. And so, loss of menstruation, infertility, even hypothyroidism, gut dysfunction, immune-related symptoms, so immune disruption of any kind, those can all be related to the birth control pill. So this is really important to understand that if you're coming off the pill and in the first 6 months you're having symptoms, it's a good idea to find a doctor to talk to about this because something else is going on. Now, women who, opt for the pill to treat symptoms, well, they usually see like roaring symptoms coming back in what's called the post-birth control syndrome. So let me explain that. Now, if you took the pill to treat acne, to treat mood swings, maybe migraines, if you did anything but prevent pregnancy with that pill, know that once you've just stopped that pill, those symptoms can come roaring back. Basically, your body's giving you these symptoms as a way to communicate with you. And what you've effectively done with the pill is you've shut down all communication. So I don't want to hear it. I'm going to walk away. And then you take the pill away and your body's like, hold up. Are you listening now? And here come the symptoms. So it's not your body misbehaving. It's not your body being bad, not by any means, okay? It's your body trying to communicate to you that hormonal imbalance, that imbalance, whatever it was that was there before the pill, that it's still there and it wants you to take care of that. So it's not that, this is necessarily a bad thing as much as an inconvenient thing, but it's also an opportunity to deal with those symptoms from a root cause perspective, which who doesn't love that, right? Making symptoms gone for good. So in terms of what else the birth control is doing in your body and how, the question I always get is like, how does this little tiny pill do all of that in my body and all of that damage? It's disrupting your hormones, causing hormonal confusion. It's disrupting your gut health. It causes inflammation, intestinal permeability, what's also known as leaky gut. It definitely messes with your mood. So the birth control pill can cause depression. And as you come off of it, mood symptoms can persist. And because it is depleting nutrients, there's a lot of symptoms that can arise from nutrient depletion. And if you didn't know that, I'm sorry to be the one to tell you that the pill depletes a whole lot of nutrients and it pretty much wrecks your body. But I get it. If you cannot get pregnant and is the only means of birth control, then please know I'm not judging you, okay? And watch my other videos to get some support. Because if you're on the birth control or you're coming off the birth control pill, you're going to need some support. And so know that I got your back and all of that. So with that being said, what should you do next if you suspect post-birth control syndrome? well, you definitely should meet with a qualified practitioner, someone who gets it, someone who's a hormone expert and understands that hormones are more than just hormones. It's about how the whole system is working. It's about your mood and your mindset. There's so much more to it than, just giving you a hormone or trying to shut down another hormone. Body doesn't work that way. Now, is there hope from healing from post-birth control syndrome? Oh yeah, you better believe it. I'm not going to bring you a video and just be like, let's just be sad now and go cry because there's nothing you can do. There are tons of things that you can do. Please head over to my blog, which is drbrighten.com. There are lots of resources there to help you, whether you're on the pill or coming off the pill, looking to control your autoimmune disease or get your hormones back in balance. You can do that. But no, if you're stopping the pill or right now you have post-birth control syndrome, you need to get lab testing, and you need to know it's going to take you a good 4 to 6 months to clear those symptoms. Now, when I'm working with a patient, we're doing targeted nutritional testing, we're doing functional lab testing, and we're doing conventional lab testing to rule out disease, to rule out anything else that could be, and to really understand how the birth control pill affected that person's body so that we can meet that individual's needs. All right, this is Dr. Brighten talking to you about post-birth control syndrome. Let me know if you have any questions. You can leave them in the comments below, or you're welcome to head on over to drbrighten.com and leave me a comment there.